The University of KwaZulu-Natal is raking up awards as head of Pediatrics and Child Health has received the National Institute for Health and Care Research Global Research Professorship Award. And the award comes with a stipend to help fund research on avoidable mobilities from asthma in children. Professor Refiloe Masekela is the first black woman to receive this award, and we say congratulations to you. Good morning, and thank you for joining us, Professor Masekela. Just how you reacted to receiving this accolade. What does it mean to you?
Thank you. Thank you very much, Cindy. Well, I think it's absolutely an honor because these awards from UK-based research to really advance people's career, to assist people in their career advancement to become full professors in their fields. And for the first time, this was actually awarded to somebody outside of the UK from a researcher from a low-middle income country. So it's an absolute honor. And I'm really excited that the funders thought that this was a worthwhile cause, and we'll be able to really make a huge impact in terms of asthma research in children in South Africa as well as the African continent.
And what had you to, especially when it comes to personal sacrifice, we often see the glory before the story. We don't know what it is that you had to push through and elbow your way into, research and development for those who have asthma, and particularly in children.
Well, I think one of the things that I've learned along the years is that nothing can be done in a silo or alone. So really, this is, although the award was given to me, I've had many, many people behind me. I've had a very fantastic team from the ARI, which is the African Health Research Institute, where the trial will be hosted. They've been a great support, all my collaborators. This is actually a team effort. So although it's awarded to me, I think it's really a team success that we'll be celebrating. And in order for us to be able to conduct this research, obviously we need a very good team around you to have these sorts of successes. And asthma, it affects actually more than 1 in 10 children in South Africa. So it's a disease that's very important. And we really need to work to find good solutions for children who have asthma to get the best treatment, because we do know that in studies that we've done already, that of adolescents, that's 13 to 14-year-old children that have asthma, half of them actually have what we call very severe asthma symptoms, which actually affects their quality of life. The children miss school, their parents have to miss work, and they can't take part in activities like the exercise. So it's a disease that is very common, but very poorly managed. So we're trying to find a solution for children as well as their families to manage this disease much better.
And Prof, just before we go, very briefly, if you'll just explain, especially with parents with young children where the child might have colic or any other symptoms, the importance of proper diagnosis. That, my pediatrician, when my children were younger, had said that asthma would present itself, but over the age of 5, if the child doesn't have a genetically or historic asthma in the family, it would dissipate, as it were, or the child wouldn't demonstrate signs of asthma. Is this accurate, and the importance of making sure that you diagnose properly and not assume that your child may have asthma for that matter?
That's actually correct, Cindy. What you're narrating is a very common story that I hear every day. Asthma can present fairly early in life, but because children have other reasons why they may have, for example, coughing, wheezing, we're now in the winter months and everybody is spluttering and coughing. But we do know that asthma is very common, as I've told you. 1 in 10 people actually has asthma. So it's usually, quite unfortunately, not recognized early enough. And even if people come repeatedly with symptoms of coughing, difficulty in breathing, and whistling noise in the chest, the healthcare workers don't recognize that as asthma. And that is why we see that many children actually suffer from asthma for a long time before the penny drops and the diagnosis is made. And this is also one of the things that we want to bring to the fore, that asthma is a common condition. It should be recognized by healthcare workers, and appropriate treatment should be started early. And I think the novelty of this research that we'll be undertaking is we're trying to study a new approach to treating asthma in very young children. We do have this approach that's been approved for adults, but we're studying this approach of using a single inhaler for both for relief as well as chronic control of symptoms, but in a younger age group. And this is actually one of the first studies that will be done worldwide. So that's why it's quite important that we find a good solution and that people do recognize asthma and treat it appropriately, because children would have recurrent symptoms, they'll miss school, they'll have many problems before people recognize that asthma is the problem. And I think you've just highlighted that.
We celebrate your success, we honor you, we appreciate you, and congratulations are indeed in order. Thank you so much. We're speaking to Professor Refiloe Masekela, Head of Pediatrics and Child Health at the University of KwaZulu-Natal.